what I'm hoping to do is just to share with you some of the research that I have done over the last decade or so, which is really focused on workplace learning in nursing. And I'm going to just give you a little bit of background about how I got interested into this field. Then I'm going to talk a bit about what do we mean by learning practice, how do we go about creating a learning culture, and then it's going to be open to questions and discussion. So when I first started doing this research, and it really stems from my whole interest in when I even did my doctoral studies, where I asked, invited first, second and third year students if they could keep reflective journals for me while they're out on clinical placements. Now, what I found fascinating was that the students often would write in their, or my participants would write in their journals. They would either write a list of tasks that they had completed during that day, or in fact, when I went back and interviewed, because I did interviews with these participants as well, one of them said, well, I didn't write anything because I didn't really know what you wanted me to write. And then when I actually explored with them further in focus group interviews, there was this real sense of that they didn't really know what they needed to know when they were a registered nurse. And more so that they were finishing, particularly my third year participants, thought that they were finishing their degree and they didn't know if they were going to be prepared to be a registered nurse. So that really started to generate my interest in how do nurses learn in the workplace? How do we help students make that transition from being in a university setting into the clinical workplace as a student, but more importantly as well, how do we support our new graduates when they make that transition into the workplace? So as part of my postdoctoral research, one of the first things that we did was we interviewed and we recruited, and I recruited second and third year students, and I actually followed them for 2 years, which gave me some really rich data because I actually meant that we followed our third year participants into the second year of being a qualified nurse, because the study, I didn't start doing my postdoc till July 2006. And I ended up with a cohort of 28 undergraduate student participants. We also, in this body of research, had 25 registered nurses who had taken on the role of a preceptor at some point in their workplace. We had 6 nurse unit managers, and we had 3 directors of nursing, because where I did this research was a large tertiary facility that had multi-sites. And what we did do, and for those of you who are doing any sort of research, you'll get a sense of the volume of data I collected, because at my students we interviewed on 5 different occasions. Our registered nurse participants were interviewed on 4 occasions, the nurse unit managers on 3 occasions, and the director of nurses on 3 occasions. So you can imagine we collated a whole heap of interviews during that time. And what was really interesting was one of the things that we actually explored initially was, why did people come into nursing? What motivated them to want to be a nurse? And really the key theme that came out was, I just want to help people. And I'm not sure if that... So this particular student said, ever since I was little, I liked taking care of other children, of people. I just enjoyed that aspect, and I suppose it's something that it can translate into nursing in that it's very caring. So that was from one of my students. Well, one of the registered nurses said, well, I'm a caring person by nature, so it's just something I've always done, so I suppose it's just me. Jane thought, well, it's helping people. It's not a job where you get a lot of financially are well paid for, but it's just helping people do those little things like fluffing up their pillows. And Nicole and RN suggested it can be very rewarding to see the patient walk out of here and you know that they're all hunky-dory, especially in extreme cases when we have people with infections and they're here with us for quite a few months. So there was a real range of people's experiences about what motivated them. So I thought, how do we then sustain that motivation to want to learn in the workplace? Because it's fine just coming into work and going, oh yeah, I'm going to do my shift and I'll go home again. And I can talk about that really freely because for those of you who know me, I actually still do clinical practice as a nurse and a midwife in a Healthscope facility. And it's a place where I've actually been engaged in employment in some form or other whilst I was doing my doctoral studies. So I've had a long association, not only being a hospital-trained nurse and midwife and working abroad, but when I came back to Australia and once I settled into my doctoral studies, I then got back into clinical practice. So I know what it's like when you have a really busy shift and you don't get that coffee break and you don't get the lunch break, and it might be I've got 5 minutes before I've got to be ready for handover. I might grab a quick cuppa so I can get my notes in order. So I know what it's like. So then to be challenged as a nurse, how do I keep learning in the workplace? How can I maximise on the perhaps opportunities that might be available to us? So one of the things about learning through practice is about what Stephen Billett, who I was really fortunate with, who mentored me. He was part of my team in doing my postdoc, and he's internationally renowned for his research in workplace learning. But he didn't start doing his research in workplace learning in healthcare. Stephen's research actually started off looking at how hairdressing apprentices learn to work and how miners, engineers out in the mines learn to work. And so through his studies of occupational, vocational-based in settings, he came and has developed some theories. So one of the things that he talks about is that in learning in the workplace, it's about the affordances and it's about engagement. So the affordances are the learning practices of the workplace. And engagement is about how we as individuals engage with our learning when we're in the workplace. And very importantly, what Stephen talks about is that learning environments, so whether you're a hairdresser or whether you're a nurse, it's that environment are really privileged by the kinds of activities and interactions that they allow people to undertake, and their interest in engaging them and not necessarily the institutional purposes. So if we think about nursing, and I often say when I've been out in clinical practice, because for many years I worked in the UK and I worked as a clinical educator, so I know what it's like, and I'd say to my students, I'd go, so why do we have to get someone up and showered in the morning? If they get showered and if they were at home and they like to have a shower in the evening, why are we asking them to be out of bed at 9 a.m. in the morning or 10 a.m. in the morning to be showered and washed and sat out in a chair when that's not their normal routine? It's not how they like to manage their lifestyle. And yes, it's different when you're in hospital and you've had surgery, and I know all about that because I've been a patient, and you've got to be out of bed. But it's about looking at, so are our institutional purposes as a healthcare facility to get our patients up and showered in the morning, or is it about being person-centred and thinking about what it is that I as the nurse need to learn, I as the student need to learn, and what it is that I need to do in my everyday practice to support the care of my client or patient that I'm looking after. So a learning practice.
Testing. 1, 2, 3, 4, 5. Testing.
So Stephen goes on and talks about the educational provisions are nothing more or less than the invitation to change. So we've got that opportunity as nurses to look at how we might change perhaps the way we engage in our learning in the workplace. So a learning practice, Stephen and I, because we actually have written about this, propose that it's a model of lifelong professional learning. And it's actually a combination of learning provided by engaging in those everyday work activities in our professional work settings. But it's also how we as professional workers elect to engage in and learn through our everyday practices. So it's about...
Respond grey, waiting room, emergency department. Respond grey, waiting room, emergency department.
So it's about...
Attention on staff, respond grey, ambulance bay, emergency department. Respond grey, ambulance bay, emergency department.
Okay, so this is the joys of delivering a presentation in a healthcare facility. However, so it's about how we might like to engage, or how do we go about engaging in that learning, and particularly when it's really, really busy. So what I'm going to now share with you are some different ways that we can learn in practice. And I'm giving examples from some of my research participants through my postdoctoral research. Because one of the things I know about our workplace is, for me, there is this constant change. It's complex, it can be chaotic, it can be this tide coming in and tide coming out. You know, when I go and do practice as a postnatal midwife, I might find out that out of, and I have to say, you know, where I work, I get allocated five women, is that I might find out of my 5 women, 4 are going home that morning, you know. So it's about the discharges going out. And then you might find that there's, you know, 3 women in birth suite waiting to be admitted and waiting for that room to be free. So there's this constant movement of activity within our workplaces. So how do we go about trying to learn them? So the first one is about what we term to as guiding practice. So that's where, for those of you who are qualified nurses, it's about how you can take those moments of opportunity and help guide someone's learning. And this was, and I'm going to leave you to read this, because this is Tony, who was a graduate nurse, and I had, as I said, in my postdoc research, so I'd got, by the time I came to interview Tony during her grad years, I'd known her for about a year, so I'd already met with her several times. And she had started her grad year, and this was her first placement. And I'll leave you to read it. Okay, so what Tony was able to share with us, and I have to let you know that Tony is a pseudonym, so any of the names that come up this afternoon are all pseudonyms. But Tony was able to talk about how much that experience meant for her, that RN had actually taken the time to stay back and to support her, and to actually say, well, you know, we do have bad days. But it was also about those elements, about this is what it's like being a nurse. This is the reality of our everyday practice. And this is how we sometimes get through these situations. Here's another example. And this was Leni, a second-year student. And in guiding practice, in our workplaces, we're not just nurses on the team. There are lots of other diverse health professionals in our team. And what Leni talks about here is that she was able to get to interact with the occupational therapists, the receptionists, the doctors, the pharmacists. She actually got to see how that multidisciplinary team and be part of it as a student. So for her, it was about, in guiding her practice, it was about, this is how I fit in as a nurse within this workplace and within this team. And for her, it was she was so excited when she shared this. I mean, I can still hear that, the excitement in her voice when she talked about how everyone on that team.
Attention all staff, respond black, front of emergency department.
Was really supportive of her learning. So, workplace learning support. Again, this is about having that opportunity to support individuals' learning. And it doesn't necessarily mean that you're having to go away and look something up on the internet or go home and review something in a textbooks, because it's about finding those moments of opportunity to learn, and it's about having those experiences where one can perhaps watch a procedure, as Sally shares, that the doctors will let you watch a procedure or explain things to you, the physiotherapists, the dietitians. So they're not the main sources, but they do give you that extra learning material. And as she goes on to say, I'm always interested in learning a new skill, and if the preceptor or the registered nurse makes me feel happy that I'm there and gets me to do these new skills, then it's more motivating to do that they want me to be there. So in the research that I have undertaken, there have been many tales where I've had my participants share with me, particularly the novices, of senses of not wanting, of not being made to feel welcome, of preceptors actually saying, oh, so I've got a student today. Oh, well, I don't know what you're going to do because I don't like having students, sort of thing. And a really powerful moment for Stephen and I was, we were sitting in a handover, and some students had come in and sat down, and not one other nurse in that room acknowledged the students. And they left at the end of handover, still not knowing what was expected of them or what was, or who was who in the ward team for that afternoon. So that support we offer is very important in having a really good learning practice in a setting. Organising and enacting a practice-based curriculum. This is about sequencing and a pathway of activities that enables us as individuals that we can progress through and develop our workplace competence. And it's based on the work by Lav and Wenger, and it's about almost having a sense of a community of practice where you can share your knowledge and look at, as Ellie here talks about, that the first few days are always, the preceptor watches you and to do everything, and they say, don't do anything unless you tell me. So I would say, I'm going to refill the burette for the intravenous therapy, and the preceptor would say, okay, go ahead. And then, I'd say, I'm going to do a finger prick on this child because there's a slip in front of the folder, and for one, and the preceptor would say, okay, go ahead. And then after it was all done and the notes were done and everything was checked, she said, I could do it on my own. So it's being able to provide those steps where you, as an RN, that you're observing your student doing perhaps a simple skill, and then giving them the confidence, particularly with senior students, in enabling them to do that unsupervised. and giving them that support to be able to do things. One of my most recent research, one of my participants shared with us how she spends the first few days sussing out her RN, getting to know her, working out where she sits with her, so almost having this sort of moment of just trying to work out where she stands, you know, is she going to be someone that's going to be very sociable, friendly, just trying to work out those little nuances of how best she can get along with her preceptor. And in a learning practice, the last area to think about is what we refer to as pedagogic opportunities. So pedagogy means teaching, so it's about having those teaching opportunities. So, and Claire, again, gave a really nice simple example is you'll go in and hand over your patients and the nurse in charge ends up telling you more than you tell them. So those moments of handover can actually be a really rich experience of learning, not just for students, but also for staff. Staff can use those opportunities in handover to engage in some actual deliberation about the efficacy of, for example, the treatment or management of a patient or client. So it's using those moments. So again, it's not having to step out and come to a presentation this afternoon, but it's using those moments where you can try and find some opportunities to engage in it, you know, just that 60 seconds of teaching. And that sometimes is all that is required. So workplaces as learning practices is very much about opportunities of what we refer to as affordances. So it's about having opportunities for learning new knowledge and new experiences. It's about decision making and discretion to make decisions. It's about observation and imitation. It's about refining, reinforcing and honing what has been learnt and being able to practice that. And it's about having opportunities to learn knowledge that would not be secured by discovery alone from more expert partners. Because you know what? Sometimes you can't always find everything on Google. And it's the wisdom that that more experienced practitioner may have that just fills that gap in your learning.
Attention all staff, all clear response grey, waiting room emergency department. All clear response grey, waiting room emergency department.
So in
Attention all staff, all clear response grey, ambulance bay emergency department. All clear response grey, ambulance bay emergency department.
So in learning from our expert partners, there are various what we refer to as guided learning strategies. So it's about the modelling, it's about the coaching, it's about the use of questioning. And they are various strategies that we can use to support the novice or even a colleague in the workplace. And I'm happy to share with you, because of the casual nature of my work as a midwife, that sometimes I forget something, or there's a new piece of equipment that's come onto the ward, you know, it's another PCA that I haven't seen before, a syringe, how to set it up. I'll actually say to one of my colleagues, look, you know, I've got a bit rusty here, can you just show me, remind me how to set this up again? So sometimes it's about having the confidence as well to say that I'm not sure or I don't know. And that's where being able to have colleagues who are happy to support you and coach you through those experiences is critically important. However, there are some limitations in learning through everyday work activities. And these are, surprise, surprise, that there are bad habits. There's a lack of opportunity to practice or extend. There's lack of support and guidance. There's doing but not understanding what or why. So it's very important, if you don't know something, to speak up. Constraining experiences. Oh, we're too busy today. We can't possibly stop and show you now. Confronting experiences where there's reluctance of workers to actually participate or engage in learning and in teaching others. What is very important in addressing these kinds of limitations is what we refer to as personal agency. And personal agency is about having the motivation and the desire, and it's almost that get up and go. It's about whether you've got that get up and go and are highly driven to actually want to learn, or whether you're just, oh, no, look, I can't be bothered, you know, it's a bit tedious. I've been working on this unit for 10 years. What else is there I need to know about it sort of attitude. So it's where you have to have that real drive and motivation to want to learn. So how do we create a workplace that actually supports learning? Because, I've said it's really busy, it's, chaotic, it's complex. Some of the equipment that we get to use is a lot more technical than it used to be, I can assure you that. Well, I, along with my colleagues Amanda Henderson and Brian Jolly, we decided that what we needed to do was look at the body of research that I had done in my postdoc and the body of research that Amanda Henderson had actually been doing up in Queensland at Princess Alexandra Hospital. And we came together and we looked at how do we determine what it is that needs to be in that workplace to support learning. And a lot of Amanda's work had been in the field of working with qualified nurses, and most of my research had been working with students. And the various tools that we had both used, I had used a tool by Dominic Chan, which was on the clinical learning environment, which was very much geared towards students' preferred and their actual experiences of a clinical learning environment. And Amanda's work had been looking at the organisational culture. So what we did do was that we came together and we developed a new survey tool that would be capture the key differences in the ways that students and both practitioners actually learn. So we wanted to come up with one tool. So we developed our tool actually originally had 55 items, and on a 5-point Likert scale from strongly agree to strongly agree, we surveyed both students and nurses in Victoria and in Queensland. And these are some of the items, an example of some of the items that ended up on our survey. So we ended up surveying 839 participants. We had 392 from Victoria, 366 in Queensland. We had 81 who were from a rural location in Victoria as well. Of our participants, 97 were male and 714 were females. We had respondents who worked across a range of clinical areas from acute medical, surgical, emergency departments, ICU, aged care and rehabilitation. Not all of our participants indicated their level of qualification. However, those who did, 330 were RNs and 460 were students. The students were predominantly second or third year undergraduate nursing degree students, or we also had 43 Master of Nursing Practice students. We had 3 students who were also doing a certificate course as an enrolled nurse. So we collected all this data. We did a whole heap of statistical analysis on it, which I'm not going to, for those of you who aren't researchers, I won't go into the depths of having to do a factor analysis. I'll just say that that's what we did on our survey. So from our 55 items, we ended up with 31 in our final survey tool through our factor analysis. What we did find in our factors analysis is that we came up with 7 subscales that we felt encapsulated the key elements of what is required for that either support or hinder a culture of learning. And in developing this survey, we didn't just survey people and run a pilot and then do a survey. We actually also had gone out and observed 95 students and nurses working together in the workplace and then interviewed them following our fieldwork observations. So quite a body of data that we collected. So the first item that we have on our survey tool is a factor that we've called collegiality, which has 7 items that form it, and it emphasises the support from others, the communication and teamwork. So one of the survey items on this is staff help each other to get the job done. So it's about that real sense of being collegiate in the way that we work. Factor 2 is referred to as workplace inertia. And this particular factor picks up 4 items that reflect the workplace practices that I've just talked about previously that impinge on creating a change in practice. So staff are sidetracked when listening to others, changing the practice in this workplace is difficult. Oh no, we can't, we're not interested in that. This is the way we've always done things around here. So it's about having that real resistance to change. Factor 3 is about being valued, and this factor centred on items that were indicative of individuals seeking to be recognised and valued for their contribution to the work of the team, because individuals actually want to be acknowledged and listened to. And a survey item on this factor is, it is clear that my work is important to the success of this workplace. So it's about just being valued. We all like to feel that we're being valued. Work satisfaction. This has 3 items that, on it that demonstrate the importance individuals place on valuing their work. So in doing so, they gain a sense of satisfaction, leading to a motivation to want to work. And a survey item on this factor, I really believe in the value of what I am doing. The 5th factor is about consideration for others and relates to the elements of respect by colleagues. And an example here is people consider colleagues' feelings. So that's one of the items. And what I have to stress here is that you have to remember that the survey items were items that both registered nurses and students felt, all answered, and that this was the sorts of things that they felt are important in creating a culture of learning in the workplace. Flexibility. Collectively, the items on this factor reflect the importance that individuals place on a variety of approaches being used in supporting learning, that enable individuals to try out new practices and encourage questioning. So in interviewing students and nurses over the last decade, what both students and nurses have often said is that not everyone learns the same way. So you as an RN might have a particular learning style, the way that you like to learn, but it doesn't mean that the student that you're perhaps a buddy or preceptor to for that shift learns in the same manner. So it's about recognising that people learn in different ways, and it's about trying to establish, when you are in that learning partnership, to work out what's going to work best for each other. The last item relates to workload balance, and it's about having a sense of relating to control, balance, negotiating workload relative to role, which was workloads allocations are carefully planned. And this was an issue where quite a few, particularly my registered nurse participants, would talk about, oh, well, you know, I don't mind being a preceptor, but it's never allocated in the roster in time, or my workload doesn't reflect the fact that I'm actually supporting a student for the shift. And, you know, so the items that load on this really were important elements in fostering a workplace learning culture. So what did we do with this particular tool? Well, and what is it important for? So we took the tool after we had come up with these factors, and we actually took it back and did some focus group interviews with some nurses and some allied health professionals. And the allied health professionals thought it would be a very useful tool for benchmarking the workplace learning culture within their teams even. It also, some of the nurse educators in particular who looked at this tool in a focus group interview actually said, wow, we could actually take this back into our team and look at how we actually support and create a learning culture just between ourselves. It does require further research in relation to disciplines and location, and I was sharing with Karen just before that I have a colleague in America who's currently using the tool and madly wanting some of my written work on this so that she can finalise her analysis. So it is being used across 3 hospital settings in the States as I present. So from this, all this research that Amanda, myself and Brian Jolly have done in workplace learning in nursing, we came up with a model. I'm not sure if it comes up particularly well on the screen there, and we've called this workplace learning in healthcare. And what we've identified is that on one side you have the academic values. So when you're sitting in a tertiary setting, there's some orderly structure about your timetable, about the knowledge generation, the fact that you've got to do critical reflectivity. When you go out into the healthcare, you've got to meet the healthcare efficiencies, doing the work, looking at the patient outcomes. And so what we talked about is that there is some orderly chaos out in the healthcare workplace. And that as a newcomer to that workplace, you have to, and it could be whether it's your first clinical placement as a student, whether it's your first placement as a grad. It could be your second rotation as a grad. It could be that you've been working on the surgical unit for 5 years and you decide to go and work on the medical cardiology unit, because all of that is a transition in the workplace, and it's a new culture that you need to go in and learn to navigate. We've talked about the negotiated order.
Front of emergency department. All clear response black, front of emergency department.
And the 4 key constructs that we feel are really important to support that culture of learning in the workplace are the items of collegiality, which came off our survey tool, respect, which really emerged from the interviews that we did with students and RNs, the element of being valued, which has come off the survey, and most importantly as well about teamwork. And it's about, as you transition into that workplace, it's about how you work through negotiating acceptance of who you are and the way that you as an individual like to learn. So in final considerations is that various workplace factors can impact upon novices learning to become a nurse. That lack of integration into team, novices need to feel welcomed, otherwise there is a reluctance to share. But limited time on the ward can actually influence the degree of engagement by both students and preceptors, because that was one of the things that really came out in all the research that I've done, is that a term Amanda and I came up with is nomadic guests, because students are a nomadic guest in particular because they come in, they might be there for 2 weeks and they go again. Some of my graduates, when I interviewed them, where they were doing their graduate, they had 3 or 4 rotations during their graduate program, and they would just find that they had got settled in and learnt about that workplace and feeling that they were learning. And because they only had a week or 2 weeks left of their rotation, they'd started to be excluded from things that were happening on the ward. Oh, you don't need to come to this session because you're moving on. So there is this real sense about if one doesn't feel engaged in that workplace, if you haven't got the personal agency to want to be engaged in your learning, that all influences how we learn in the workplace.